So there are a number of benefits of doing cognitive behavioural therapy. It's something that's highly recommended in most of the Western world, at least, as being the treatment of choice for a number of different conditions. For example, the National Institute for Health and Care Excellence recommends it as the treatment of choice for things like depression, bipolar disorder, schizophrenia, generalized anxiety disorder, panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, bulimia, anorexia, alcoholism. So a whole range of different issues. It's cost effective because it's very focused on driving change. So it's about creating change. Rather than sticking stuck, going over the same thing over and over again, it's about keeping the sessions to as few sessions as possible, because you're saying, okay, let's move things forward. So between now and the next session, what are you going to do to move yourself forward with this problem? Between the next session and the session after that, what are you going to do to move yourself forward between the next session? So every session you're trying to move a client forward, you're trying to have them educate themselves, trying to have them learn how to get themselves out of a problem and have the skills so they don't relapse. So not only does it require fewer sessions than many other forms of counselling and psychotherapy, but because it's very skill-based and it's about people learning skills, people don't relapse so frequently because they have the skills and the knowledge to know what they need to do to get themselves back on track again. So if, say, a smoker quit smoking with cognitive behavioural therapy and then some point randomly in the future they had a cigarette, they have the skills to be able to look at it again with the same cognitive behavioural techniques to then unpick it and say, right, that's why I smoked, so I know why I ended up smoking and having that one cigarette. That was my thoughts, that was my feelings, that was my behaviours, that's what happened, this is what I need to do to get back on track and to stop smoking and make it an isolated incident. So even when you do end up having a relapse, you're back on track much quicker. And it's really, really easy to learn. It's easy to learn for therapists learning to do CBT, but it's also easy to learn for the clients themselves. So that's a huge advantage. It's not like you have to go to university for years to master the simple skills.